Hello and welcome to another video. In today's video, we'll talk about genital herpes. We'll talk about the causes, the signs and symptoms, the pathophysiology, how the diagnosis is made, treatment options, and the complications. Genital herpes is a common sexually transmitted disease caused by the herpes simplex virus. Individuals suffering from genital herpes develop painful blisters on their genitals. Teenagers and adults of all genders and races are affected by genital herpes. Sores and blisters from genital herpes can form on or inside the anus and buttocks, inner thighs, the vagina, vulva, labia and cervix. It also affects the penis and the testicles. Other sites that can be affected apart from the genital areas are lips, mouth, tongue, cheeks, and roof of the mouth. Even if a person does not have blisters or symptoms, the herpes virus can still be transmitted to another person. Now let's have a look at the prevalence and incidence of genital herpes. Both herpes simplex virus 1 and herpes simplex virus 2 infections are lifelong. About 67% of people below the age of 50 years, which equates to 3.7 billion people, have herpes simplex virus 1. An estimated 491 million people aged 15 to 49 worldwide have herpes simplex virus 2 infection. Most oral and genital herpes infections are asymptomatic. Herpes infections are most contagious while symptoms are present, although they can still be transmitted to others when symptoms are absent. Infection with herpes simplex virus 2 increases the risk of contracting and spreading HIV infection. Genital herpes can spread if you have multiple sexual partners and don't use condoms when engaging in sexual activity with an infected person. Direct contact with lesion fluid via skin-to-skin contact. You can also get herpes from kissing someone who has open sores in the mouth, and perinatal route where child gets herpes during birth from infected mother. The virus that causes genital herpes is highly contagious. There are two types of herpes simplex virus infections that can cause genital herpes. The first one is herpes simplex virus 1. This type usually spreads through saliva when you kiss someone with open herpes sores. And also, it can be spread by sharing personal items like toothbrushes or even lipsticks. This normally causes cold sores or fever blisters around the lips, gums, on the tongue and inside the mouth. It can spread to genital area and cause genital herpes during oral sex with an infected person. The second cause of genital herpes is herpes simplex virus 2. This virus causes genital herpes. It is spread through sexual and skin-to-skin contact with an infected person. Some people never experience symptoms. They are unaware that they have a herpes virus, which causes genital herpes. They may unintentionally infect others. You can have a herpes virus for years without experiencing symptoms, making it difficult to determine when or from whom you contracted it. Symptoms usually develop 2 to 20 days following infection. When present, symptoms of genital herpes include flu-like symptoms like fever, chills, tiredness, and muscle pains, headaches, itching or irritation in the genitalia, small red bumps or tiny white blisters, blisters or sores on the genital area that are painful and break open, ulcers that form when blisters rupture, swollen lymph nodes, painful urination also called dysuria. On the pathogenesis of the virus, after infection, the virus moves from skin cells to nerve cells. In the nerve cells, it enters an initial period of replication, after which it becomes inactive, what is also known as the latent phase or latency. During reactivated infection, the virus spreads distally from the ganglion to initiate new cutaneous and mucosal lesions. The virus may be reactivated by certain triggers, and these are immune suppression, illness or fever, stress, menstruation and surgery. The diagnosis of genital herpes is based on physical examination and the results of laboratory tests. Blood test. This test examines a blood sample for the presence of HSV antibodies in order to detect a previous herpes infection. Viral culture. This procedure entails collecting a tissue sample or scraping the lesions for laboratory evaluation. And polymerase chain reaction test. Unfortunately, there is no cure for genital herpes. Infections might reoccur, causing later outbreaks that are usually milder than the first outbreak. Antiviral drugs have the potential to prevent outbreaks. They can also assist to alleviate symptoms and speed up their resolution. They also reduce the frequency of recurrence. Antiviral medications that may be helpful for genital herpes include acyclovir, also called Zovirax, and valacyclovir, also called Valtrex. The complications of genital herpes infections are increased risk of HIV infection and other sexually transmitted disease, risk of vertical transmission to newborn babies, and severe emotional stress from diagnosis. That's all for this video. Thank you for watching. If you find this video helpful, please like the video, share it and subscribe to our channel. Till next time.